I'm Heidi and I'm going to explain the extubation procedure. So once you get an order for an extubation, you are going to verify that order. You're going to communicate with the patient's nurse to make sure they know what's going on so they can be in the room and assist you when needed. So after that, you are going to walk into the room, you're going to perform proper hygiene, you're going to wash your hands, and you're going to put on gloves. And after you wash your hands and put on gloves, you are going to inform the patient why you're here. So Mr. Jones, my name is Heidi, I'm a respiratory therapy student, and we are going to take the tube out today. We're going to perform an extubation. So after you inform the patient, you are going to gather all the equipment necessary that you need for the procedure. You're going to need some scissors, a syringe, you're going to use a yanker, as well as a red rubber catheter, and you are going to have a supplemental oxygen device. For this instance, I have a non-rebreather. After you've gathered all the equipment necessary, you are going to make sure the patient is in a semi-Fowler's position, and you're going to assess the patient's vital signs. You're going to listen to the breath sounds. Mr. Jones, I'm just going to listen to your lungs, and you're going to listen to see if there's any indications for suctioning, and you're going to look at the vital signs, so blood pressure, you're going to look for respiratory rate, heart rate, SpO2. Once you have all of that done, you are going to hyperoxygenate the patient. So you're going to click hyperoxygenate, and you are going to look for any necessary indications for suctioning. If you see any secretions in the mouth, you're going to use the yanker, and you're going to suction out all that you can get with that. If you heard any rhonchi breath sounds or have any other indications for further secretion, you can use the red rubber catheter to get the secretions around the tube. Further down, you want to make sure you get all these secretions, especially the ones that might be sitting on top of the cuff. So when it's deflated, the mucus and secretions don't fall down into the lungs. And so after you have finished with the suctioning, you want to go ahead and perform a cuff leak test. So you are going to deflate the cuff, and you're going to be listening to see if you can hear any air moving. You can also feel, you can auscultate, listen for any of the sounds, and in the case that air is moving, you want at least 15% of the tidal volume to be coming out, and so it means it's a go. You can continue to do the extubation procedure, and so after you do that, you're going to reinflate the cuff. So after that, you are wanting to move on, and you can now start extubation. So you're going to remove whatever is holding the ETT tube. So in this case, it's an anchor fast. And so you are going to start to remove the anchor fast, and you're going to ask your nurse to come and assist. Mr. Jones, I'm just going to reach over and, all right. And so I'm going to unclip. I'm going to ask my nurse to hold the tube stable for me as I continue to take the anchor fast off. All right. And once you do that, you're going to deflate the cuff, and as you do that, you want to ask the patient to take a deep breath. You want to prime the patient to make sure he has a big breath. You're going to deflate. Now, Mr. Jones, can you take a big cough for me? And as the patient coughs, you want to remove the tube, the natural curvature of the tube, and continue to encourage the patient to keep coughing. You're going to supply your supplemental oxygen, and you're going to have the yanker ready to get any secretions that the patient is coughing up. You're going to make sure you can help assist the patient. You're also going to reassess the vital signs to look for any indications of tracheal necrosis, or you're going to look for the glottis edema, you're going to look for laryngospasms. You're going to just make sure the patient has tolerated that okay. You want to make sure that he's not going to aspirate. After that, you just look at the heart rate, respiratory rate, SpO2, blood pressure, all that. Make sure that the patient is doing okay. Once you do that, you're going to communicate the time of extubation. You want to make sure the nurse knows all that went on. You want to go ahead and document all of those things that you went through, and you want to recommend any airway clearance or lung expansion devices.